Hey everyone, ready to dive into something a little different.
Different? How so?
Well, we're talking holiday stress,
How's
but
that?
not the, running around buying presents kind of stress. We're looking at how the holidays impact the behavioral healthcare field.
Oh, interesting.
Yeah, it's funny because we think of the holidays as, you know, joyful and happy and
Right, right, all that.
yeah, but for people working in behavioral health,
It's kind of the opposite.
it can be a really tough time.
Yeah, yeah.
We've got this article called The Holiday Surge. It's a guide for behavioral health leaders
Okay.
about how to protect their mission and their team
Uh-huh.
during the holidays.
I see.
And we've also got some audio instructions that go along with it. They both talk about this thing
Okay.
where, like, while everyone else is, enjoying the holidays,
Yeah.
behavioral health professionals are dealing with a huge increase in mental health crises.
Makes sense. It's a stressful time of year for a lot of people.
Exactly. And it's not just the really intense situations.
Right.
The article actually points out that a lot of regular appointments get skipped during the holidays.
Oh, wow. So it's
Oh,
like a double whammy.
yeah, it's like they're getting hit from both sides.
Yeah, yeah.
So you've got this increase in people needing help,
Right.
and then you've got fewer people coming in for their regular appointments.
Yeah,
So
that makes it tough.
it's a real challenge for these behavioral health
I
workers.
bet. Especially when they're probably trying to enjoy the holidays themselves.
Right. They're not immune to the holiday stress.
Yep.
So the article talks about some ways to support these frontline heroes, especially during this time.
Okay, I'm all ears.
One thing that really jumped out at me was this idea of creating dedicated wellness spaces for staff.
Wellness spaces.
Yeah. So picture this, you've got like a quiet room, maybe with some comfy chairs, soft lighting,
Okay,
maybe even like a diffuser with some calming scents.
I like it.
It's like a little sanctuary where staff can go to, just decompress,
Yeah.
take a break,
Take a breather.
especially after a tough interaction with a patient.
That's a great idea. Everyone needs a place to recharge, especially in that kind of environment.
Exactly. And speaking of giving staff time back, the article also talks about how important flexible scheduling is during the holidays.
Oh, yeah, that makes a lot of sense.
Yeah, it's about recognizing that staff have families and traditions of their own.
Right.
And, they want to be able to participate without feeling guilty or penalized.
Of course, of course.
So whether it's, adjusting shift times or allowing for some time off,
Right.
it can make a huge difference in reducing stress
Yeah, I bet.
and boosting morale.
It shows that you, as an employer,
Yeah,
you get it.
yeah.
You understand that they have lives outside of work.
Exactly. It's a simple way to show staff that they're valued,
Yeah.
not just as employees, but as people. And then there's this whole section on meaningful recognition, which I think is so important in a field that often goes unnoticed.
Yeah, I agree. It's easy to overlook the emotional labor involved in behavioral health care.
Right. Especially during the holidays when everyone's feeling the pressure.
Yeah, everyone's got their own stuff going
Or
on.
just a simple thank you
Yeah.
or a handwritten note.
Yeah.
Or even just publicly acknowledging the team's hard work.
Right.
It can go a long way in boosting morale.
Yeah, it's like a little shot of appreciation that
Yeah.
can help them get through those long holiday shifts.
Exactly.
Right.
Okay, but here's where things get really interesting. The article dives into the role of technology
Oh.
in supporting staff well-being.
Technology.
Yeah.
Huh. That's not usually what comes to mind when we think about emotional support.
I know, right?
Yeah.
But they make a really compelling argument for how optimized electronic health record systems can actually free up staff to focus on what matters most, to have those face-to-face interactions with patients.
Especially during times of stress.
Exactly. So it's like taking the administrative burden off their shoulders, allowing them to be more present
Yeah.
and attentive to their patients' needs.
Friends.
So it's really about recognizing the unique challenges of this season
Yeah,
and providing support that's sensitive and responsive to those needs.
for sure.
Okay, I want to shift gears a bit and talk about leadership. The article really emphasizes the vital role leaders play in supporting their behavioral healthcare teams, especially during the holiday season.
Makes sense.
It's like being the captain of a ship navigating stormy seas.
Okay, yeah.
The article highlights some specific leadership qualities that are really important during this time.
Like what?
Well, for starters, it's about being understanding of family obligations
Yeah.
and their impact on schedules.
Right, because the holidays are all about family.
Exactly. And Leaders who acknowledge and respect that
Uh-huh.
are going to create a much more supportive and less stressful environment.
For sure.
And it's not just about being understanding.
No.
It's about providing tangible support when staff feel overwhelmed.
Okay.
So that could mean bringing in extra help, covering shifts,
Yeah.
or even just offering a listening ear.
Right.
Leaders who are willing to roll up their sleeves and pitch in alongside their team, that sends a really powerful message.
It does. It shows that they're not just the boss, they're part of the team.
Exactly. The article also mentions the importance of recognizing and appreciating staff dedication during this time.
Oh, yeah. Recognition is huge, especially in a field that often deals with heavy emotional stuff.
Absolutely.
Yeah.
So whether it's a heartfelt thank you note,
Yeah.
a small gift,
Yeah.
or a team celebration,
Right.
acknowledging that hard work and sacrifice can really boost morale.
Yeah. It creates that sense of shared purpose.
Exactly.
Yeah.
Like, we see you, we value you, we
Yeah.
appreciate everything you do.
Exactly.
And finally, the article talks about how important it is for leaders to provide clear direction
Okay.
while also being sensitive to emotional challenges.
Right. That's a tough balance to strike.
It is, especially during the holidays.
Yeah.
But it's about setting clear expectations, providing support and resources,
Yes.
while also recognizing that everyone is carrying personal baggage.
Right.
And might need a little extra grace during this time.
Yeah. Everyone needs a little extra grace during the holiday.
Exactly. So it's about being both firm and compassionate, which is a hallmark of really effective leadership.
Yeah.
The article specifically mentions that self-care is essential,
Oh, yeah.
even for those in leadership roles.
Self-care is so important. It's like the oxygen mask analogy. You have to put on your own oxygen mask before you can help others.
I love that analogy.
It's so true.
Leaders who prioritize their own well-being
Uh-huh.
are much better equipped to support their teams
Yeah.
and navigate these challenges.
Exactly. If you're burnt out, you can't help anyone.
The article seems to be suggesting that the holidays are kind of like a stress test for the entire behavioral healthcare system.
That's a good way to put it. It exposes the vulnerabilities in the system.
Right, the areas where support might be lacking.
Exactly.
And it's an opportunity to identify those weak points
Uh-huh.
and come up with solutions that will benefit everyone.
Yeah, not just during the holidays, but all the time.
It's like using the holidays as a springboard for systemic change.
I like that.
The article even points to January as a key time for reflection and renewal.
Oh, that makes sense. After the holiday rush, it's important to give staff time to process their experiences.
Yeah, maybe even some extra support to get back into the swing of things.
For sure.
And it's also a great time for team appreciation initiatives.
Absolutely. Behavioral healthcare workers deserve so much more recognition than they get.
They really do. We should be celebrating these folks all year round.
Agreed.
We hope you got some new insights and maybe even some new ideas about how we can work together to build a stronger, more resilient behavioral healthcare system.
Me too.
And remember, even small acts of kindness can make a difference.
Yeah.
So be kind to yourself, be kind to others,
Yeah.
and let's keep this conversation going.
Sounds great.